Hi, I'm Dr. Lorena Amato, endocrinologist, and today I will talk about hypothyroidism. Hypothyroidism is a very prevalent disease in the world, including the United States. It's caused for the underaction of the thyroid, a little gland that produces T3 and T4 hormones that regulate the metabolism. Hypothyroidism can affect all body, and the symptoms are variable. Can be mild to severe. The symptoms are different for each person. They are difficult to notice and start slowly. The most common symptoms are dry and cold skin, sparse and dry hair, constipation, irregular menses in women, joint pain, weight gain, low pulse. These symptoms can be mistaken diagnosed as depression. How we can diagnose hypothyroidism? The diagnosis is made with the measure of the hormones on blood. We must measure the hormones T3, T4 and TSH. In hypothyroidism, the TSH is high. The most common cause of hypothyroidism is Hashimoto thyroiditis, an autoimmune disease. Sometimes hypothyroidism can occur after the treatment of an overaction thyroid. Hypothyroidism also can occur after the pregnancy. The goal of the treatment is return the level of the hormones to the normal range. The goal of the treatment is return the level of the hormones produced of the thyroid to normal range. For this, the patients must take medicine every day. For the most of patients, the treatment is for the rest of their lives. On the follow-up, it's necessary measure of the hormones on blood to make sure that the correct dose of the hormone is used. If you feel some of these symptoms, think if you could have this disease, it's necessary looking for an endocrinologist for make this diagnosis. If you have any questions,